This is Dr. Selene, Parekh, the Fantasy Doctor. Apparently, my other Periscope feed did not have any audio attached for whatever reason, so I'm going to repost and talk about again Steph Curry's knee. Now, he had an awkward fall during the second period, second quarter of today's game where he slipped on some water that was on the court. Now, if you saw the video, it looked pretty bad. He grabbed that right knee right away. And from what we can tell by the video analysis alone, there is an MCL injury or sprain. Now, he's going to have an MRI, and that's been updated since my last post, that the MRI will happen. And what the Warriors medical staff is looking for on the MRI are a few things. Number one, want to look at the MCL ligament itself. Now, the MCL is a ligament that lives on the inner part of your knee. You can actually feel your MCL through the skin on the inner aspect of your knee. There are a variety of different sprains that you can have of it. They have different grades. A grade 1 is a mild sprain. It's really more of a stretch, and players usually miss about 1, maybe 2 weeks worth of time, but usually on the 1 week time frame. Grade 2s and 3s are much more severe. Rarely does it need surgery, but oftentimes it can take 4 to 6 weeks or more to recover off of a grade 2 or 3. These injuries usually need a knee brace. Now, grading this sprain will be very important, but most important is to also make sure there's no associated injuries, like an injury to the ACL, the PCL, or the lateral collateral ligament, or bone or cartilage injuries. And all of that can be evaluated with the MRI. Once we know what the MRI shows, which we should have that information sometime tomorrow, we can then start putting a timeline together for Steph Curry. Now, at the end of the day, what really matters more than what the MRI shows is his symptoms. Does he have any instability? What is the pain like? Does he have any issues running and cutting and jumping? If there are no issues there, then you'll see Steph Curry get back onto the court much sooner. If there's any problems, though, look for him to have some extended time loss. This is Dr. Selene Parekh, the Fantasy Doctor.